everyone, I'm Kimberly Parker, Executive Director of Sierra Nevada Memorial Hospital Foundation, and today, appropriately social distance apart, I'm being joined by Dr. Jeffrey Rosenburg, who is the Chief Medical Officer for Sierra Nevada Memorial Hospital. I know you've been getting updates from Dr. Evans on what's going on at the hospital, but I thought it would be interesting to hear a little bit on the perspective from our Chief Medical Officer. So welcome, Dr. Rosenburg.
Good morning, Kimberly. Thank you for inviting me today.
Nice to have you here. So I think one of the things that people are interested in knowing a little bit more about, and that is, what's it been like on the inside, at the hospital during all of this? Like, what are you seeing, like, on patient floors and all? How's life different?
Well, it's been an endurance test where we've been in what's called code triage with our incident command activated for about 2 months now. And we were hearing about and watching the news like everybody else about the tremendous amount of surges and the potential of overrunning healthcare resources. So we started very early preparing for that. And I think there were a lot more anxieties in the building initially because it was so new, but as we started taking care of patients and as we were able to actually get more rapid testing and reduce the amount of personal protective equipment that we use, and we had isolated areas for patients who were either under investigation or who had COVID-19, that everybody settled down into a routine. I've been very impressed with the dedication, the caring, the compassion of everyone in the building. Everybody from environmental services to our nursing staff, to all our ancillary services, to our doctors, nurses, physicians, everyone has just done a tremendous job and has really put the care of the community and the care of the patients first.
So how have you seen things like the supply chain, work during this time frame?
Well, they've been working 7 days a week, and we've also been in daily communication with our divisional supply chain. So there's 6 hospitals in our Sacramento division, and Sierra Nevada is one of those. We have had some interruption in some of our usual vendor supplies, but they have been coming. We've never not had enough personal protective equipment to utilize, or cleaning supplies or anything that we would need to run the hospital normally. We have asked the county through their medical emergency supplies to supply some masks, some gowns, things like that, and they've always been able to do that. So right now we have quite a bit of supply on hand. We have at least 14 days supply on hand, and also our daily usage is much decreased now because we get the results back on patients who we are testing within 30 minutes, and so we don't have to utilize what we call our burn of a lot of personal protective equipment for people who are still trying to determine whether they have COVID-19 or not.
And if I can ask also, how is information being communicated out at the hospital between the team?
Well, for any emergency sort of thing, we have what we call X Matters. So that goes out by email and text on your cell phone. So everybody's gets information immediately. But we've still been having our Incident Command Center reporting out with people, with our leadership team calling in on that. And then we have our leaders communicating out to hospital personnel. I know that I've been rounding on every department in the hospital, not necessarily every day, but many days during the week, and just stopping and talking to people and passing along information that way as well. So I think we're usually always very good at giving out information, but we're making a special effort to make sure that we're communicating with everyone now.
And I guess people are very curious if the hospital's a safe place to come to, if they need other kind of care, not COVID care. And I know we're talking about starting some, electives up again. So could you talk to our community about that?
Yes, I think that the hospital is very safe because we have a process for segregating people who have had fever or respiratory symptoms who are coming into the emergency department, so they're being segregated away from everybody else. But we have the normal mitigation factors that have been very effective. We have universal masking, which is basically source control, so I don't infect you. We're screening everyone who's coming into the building. We're having limited amounts of visitors coming into the building, so we have some restricted access. In regards to cases, I was on a call with Dr. Cutler this morning. There's been 41 confirmed cases by test within Nevada County. More than 2/3 of those have been up in the Truckee area. And in the western part of the county where we are, the incidence has been very flat for well over 2 weeks, and our peak, they're thinking, was the week of March 26th to April 2nd. So I think it's very safe with the mitigation that we're having. We're looking to reopening a little bit. So for example, we're calling it sort of essential services. We've always been doing surgeries on people who had urgent or emergent things, but now we're going to start doing some electives that if they get delayed anymore, maybe the results won't be as good. So we're actually having 8 people who are having preoperative testing. So we're testing all patients who are having surgery with the COVID test, and 8 people are coming in a drive-by fashion today, and our nurses are going out to swab them and sending those tests out, so we'll have those results back by the time they come into the building for their surgeries on Monday.
Well, I really want to thank you, Dr. Rosenburg, for taking a couple minutes so we can update our community a little bit, and hopefully we can do this more often as this all continues. And to everybody out in our community who's been so supportive of our hospital during this time, please know we are deeply grateful for it. For those that are interested in knowing how they can more directly support our hospital, we do want to let you know we do have a COVID-19 fund that is going to be very instrumental in helping our hospital. You can find that on our website at www.supportsierranevada.org, or you can always call me at the office at 530-477-9700. This is Kimberly Parker with the Sierra Nevada Memorial Hospital Foundation, and we thank you for joining us. Bye-bye.